And that's in preparation of you getting ready for your NCLEX, okay? So I know we're going to go out sometime and do Christmas shopping. And dollar store is great for decorations. So if you're in there, just take a peek and look. All right. Brianna, you've been waiting for me. Your ID, please. Okay. And do you use a whiteboard? What do you use?
Nothing.
Good. All right. And you're set up good. Oh, you're an iPhone again. Let me see.
It's Esther.
Yes, Esther. Esther. Yes, I know. Let me rename you.
Thank you.
Esther, and which last name you want me to use?
Arellanes.
Arianas. OSAS. AS.
Yes.
That's close enough, isn't it? Or pretty good?
Yeah, it's okay.
All right, we'll work with it. Bernice. Okay. Do you have a whiteboard? What do you have? Piece of paper. Okay. Again, I'm going to mention it every time. Just make sure as you're out in your travels this Christmas season, this holiday season, to get yourself whiteboards. You're going to be needing them. Okay. Eden, there you are. May I have your ID, please? The other way, to your left. Yeah, good. All right. Can I have your ID, your piece of paper? What do you have? You have a whiteboard. Good, 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 good. Hi, Kelly.
Hello.
How are you, my dear?
I'm good. How are you?
I'm good, thank you. Okay. Piece of paper, whatever. Yeah. You have a whiteboard. Good. The one that I just did. She disappeared. All right. Okay, tiara. Whenever I think of you, I think of a tiara on my head. I feel like I have a crown. You have an ID, please. Okay, good. Do you have a piece of paper? What do you have? All right, beautiful, perfect. You have the protector with a piece of paper inside. I think that's the cheapest way to work. And you know, all of your professors have that somewhere. It's in the college somewhere if you just want one piece. Hi, Shannon. How are you today?
Good. How are you?
You're in your basement again?
Yep. Safest place to hide from the kids.
You know, whatever works, it works. That's fine. Do you have your ID, please?
I do.
Okay, good. And do you have, okay, your whiteboard? And give me more of a side view if you could, please. I'd appreciate it. There we go. And Kay is not at her desk, so I'm waiting for her. We're doing good today with time. Oh, there she is. She heard me. ID, please. Closer so I can see. Okay, we got you. I see you. All right. And good. All right. Piece of paper again. Remember, get yourself a whiteboard as you're out this season. They have them cheap, small ones in the dollar store, which is now $1.25 now down here. I got some great Christmas decorations through my years. Putting up my tree this weekend with my grandson, I was remembering these bows and balls. I bought for $1 and I still have them 15, 20 years later. I still use them. It reminds me of all the struggles we have as single parents, right? So I'll always remember them. Sydney, do you have your ID? I see it on you. Okay, and blur your background for me, if you would, please. Has everybody downloaded the exam? NUR203, exam 3. 221. Go here. Yeah, it looks like everybody's downloaded. Good job, everybody. I didn't do too bad with your name, Esther. I could have done it a lot worse. Pretty good for a green guy, as I say, to even have an understanding of the double L's. Anyway, everybody, this is great. We're running right on time, and I love that. Anybody with any questions, any concerns right now? Remember, I do not need to see that you've completed the exam. I can tell. If I'm not getting the download, I will reach out with a message on Canvas to you, okay? Sometimes those downloads don't go right away. Don't freak out. They don't lose the exams, okay? The exam is always there. So that's been one of the things students like all of a sudden they get red and flushed and hypertensive. Don't worry. If you can't download it right away, 2 days later, we can still find it. So please don't do that to yourself. So after class, we are going to do a Kahoots. And you know what I decided, in respect to all of you, we're going to do half of 100 question Kahoots for the day class for my 3 to 5. Tonight, I'm going to do the second half, and I'm going to send both recordings to you. Okay? It is 100 question Kahoots, and this is the new and updated version that I went through and looked at all of the concepts that are on the HESI and ones that I know you're going to see on your NCLEX, putting it all into one for you. So I'll be sending out those reviews. I always put week 1 through 9 Kahoots in there in case you have something you're weak on. So it's in one place that you can look at. And I also put exam 1, 2, 3 review on your HESI review. So anything you need will be in one place. Okay, I try to get you all organized. It's enough for 3 classes. It's the least I can do to help you, okay?
Thank you.
Thank you.
You're very welcome, not a problem. I find out you all do better if you're not stressed out looking for stuff. And I know if you do what I tell you to do for HESIs, you all are going to do well. I know that the grades keep going up and up and up on the HESIs. So I will, when we get to class after this exam, I will let you know what to do, okay? So this is exam 3. We will come back for class at 4:15. Just come back to the Zoom. Again, if somebody's still testing, I will let you know so that you can come in, put yourselves on mute and be quiet so that we can help. If you have or need a re-entry code, anything like that, whatever code pops on the screen, send me a chat message and I'll get back to you as soon as I can. Don't worry, I will get back. You don't have to talk over the class. Again, we're giving respect to everybody. Everybody deserves a quiet environment from at least the Zoom environment. I don't know what's going on in your background, but I know at least it's not us trying to talk. So everybody, put yourselves off of mute and I'll mute everybody. Home, get yourself off of mute. And I'll put you on mute. All right, let me just go ahead and mute everybody. Again, everybody, it has been a great semester with all of you, okay? I know you want to know your exam grades, especially you on borderline. I'll give you thumbs up or one of these. Not all I can do for you, but at least it's something to decrease your stress. You're not getting grades till Friday, but I can work with you because I know what you're going through. This is the end, getting ready for Christmas and next semester, and you're seeing that light at the end of the tunnel. So everybody, here we go. This is your access code for this exam. I will put it in the chat box. Again, I will put my face off a camera. You don't need to see me looking at you, and I'll put myself on mute. Come back at 4:15, okay? So the access code, I'll say it twice. Capital H, number 7, little p, capital J, capital Y as in yellow, and capital D as in David. Again, capital H, number 7, little p as in Peter, capital J, capital Y, capital D as in David. Again, anybody who needs help, please from now on, go through the chat box. And I wish you all good luck. Okay, I believe we have just finished, everybody. So thank you for being patient, okay? So here we go. We are now into HESI. I know a lot of you want to know your grades. As I said, I can give you a thumbs up or down. It's about all I can do for you, but you will get your grades by Friday afternoon. We're going to have a meeting even before my Friday night class because I know you're all in stress. Those are at risk. I will reach out to you before then. So if you don't hear from me, then you know you're okay. All right, we're going to work with it that way. So we're going to be doing a HESI review. Now, this is the way I've decided to do it because, you know, your time is as valuable as mine. So we're going to do half of 100 question review. So many people ask me, how do I study for the HESI? Well, you have a lot of information. You've got exam 1, 2, and 3 reviews. You also have all the Kahoots from weeks 1 through 9. And I'm giving you 2 HESI Kahoots that are 100 question. I'm going to go over the most updated one today. Okay, I went back, I looked at last HESI, I saw where those concepts were being missed, and I made sure there's questions in this HESI. So it used to be a 90 question, it's now 100, and I've thrown some out too. There's about 15 more questions there that you have that I had to put in to make sure that you are getting everything you need. So please study those HESI Kahoots, especially the one I just did. You're also going to be getting a PowerPoint, which has it more written out for you to look at. Now, it is almost 200 slides. You're going to go, oh my goodness. There's 103 slides of information, but after that, there are questions. Very similar concepts that you're going to see on the HESI. So there's 103 slides to look at, but the 104 through, I think, 190 something are just questions, but it's ask a question and then the answer. So it's 2 slides per question. So about 45 questions there to look at. Another thing I highly recommend is to go back and look at your NCLEX book and look pediatrics and make sure those little boxes that you see, those important information, look at those little boxes because that's where they like to take questions from, just to tell you what I have seen. So study the Kahoots, study the PowerPoint, and study your HESI book. And if you don't understand something, go back to all the other information that you already have. Now, I know I have a class here. There's 2 classes here today. One of the professors did have off. Today's a PTO, and I'm taking her class over. So if any of you need any information, reach out to me and I'll send it to you. Or I will make sure that I post it in the announcements, okay? I will post all of this stuff in my review today. I'm doing the first 50 now, and then the last 50 on a class tonight. So tomorrow, early afternoon, you're gonna get 2 different YouTube links to connect to, okay? So here we go.
Just a quick question. When are you doing that review tonight?
8 o'clock. Now, it's an exam first. If you want to come back and you want to watch it, 9:15. It's going to
9:15.
be the second half. So it's 50 questions. So I figure about 40, 45 minutes, I should be able to get it in. So if you want to come back, please come back. You're more than
Okay.
welcome.
Thank you so much.
Thank you for reminding me to say that because yes, if you want to come, please come. I will never, ever turn a student away. Now, as we're doing this, because y'all don't know who I am, if you have a question, I am never offended. You don't bother me. Stop me, say, Professor, I have a question. I don't understand, and I will answer you. So go to the Kahoots and sign in, game pin 319-6125. I should be done about right at 5 o'clock. I might run a little bit over, but please try to hang on. But remember, if you have to go for whatever reason, I understand, you will be getting this posted, even from Professor Corafor. You will get this tomorrow. I will make sure it's posted in your announcements. So don't say, how am I getting it? Look at the announcements. And along in the announcements, I will post the HESI PowerPoint review. You will get everything, okay? So don't worry, I'll take care of you. All right, let's go ahead, let's get started. We've got a lot of work to do and about 36 minutes. So brand new review, 22, December. What is probably the single most important influence on growth at all stages of development? I mean, my class has heard this. I repeat it over and over and over again. Nutrition, nutrition, nutrition. And that's what I'll always say. No nutrition, you're not feeding the brain. You're going to be cognitively delayed. You're going to be short. Your growth's going to be delayed, everything. How would you initially treat a 6-month-old infant diagnosed with GERD? I mean, this is before medicines. I mean, we know we can give some ranitidine, some Zantac, some Pepcid to help with the stomach acid, but we can do it very simply. And we can give rice cereal. And what that does, it thickens the cereal, so it holds it down. And it's 5 mL. So if you have a bottle, like those little bottles they give to you when you're in the hospital, those little 2-ounce bottles, 5 mL per ounce. So 10 mLs, you put the rice cereal in, fill it up with the formula or breast milk, and that's the formula for it. During an assessment on a 2-month-old, you notice that the head circumference has increased 2 inches. Next action to take. Like, what are you going to look at next? You see the head is big. What are you going to look at? 1839. So we know part of our assessment that we do on all newborns, we're going to be taking head circumferences at least daily or once a shift, and abdominal girths, making sure they're feed. If we are seeing their heads are getting bigger, if it's hydrocephalus, we're going to see it in the fontanelle. So fontanelle will be the next thing. Is it soft? Is it flat? And at rest, okay? Sitting up, resting, if it's flat, we're okay. If it's bulging, when they're not crying, we need to do something. And of course, that's going to be told to the doctor. Frequent developmental assessments are important for what reason? Like, why do we have to look at gross motor skills and fine motor skills and looking at heights and weights? And why do we do that? You go to the doctor, go to the ER, urgent care, it's height and weight and head circumferences and abdominal girths. And it's because if we have a child who's delayed, if we can do early intervention as early as possible, we can catch them up. So we can see delays, we can see deficits. If they are not lifting their head, if they're not able to grasp a rattle by 7-8 months, something is going on. So we need to evaluate why. And we need to give, whether physical therapy, occupational therapy, speech therapy, whatever it is, we can start quick. Multi-select. An infant just received a 2-month set of immunizations. Discharge teaching should include what? Like, what is the parent to expect? So immunization sometimes causes a lot of redness and swelling and heat and discomfort. So Tylenol is directed usually every 4 to 6 hours, and the dose as per the pediatrician. A cool pack will help with that heat. And then you pedal the legs, and it sort of helps the muscles to move and to move that medicine around so that it will stop the inflammation. A fever is usually expected. It's the body's response. So unless that fever's 105 and staying there, there's nothing to do with this. A head to tail direction of growth is referred to as what? And that talks a lot about your gross motor skills, being able to lift your head up and turning over, creeping, crawling, and walking. That's head to tail. And that cephalic is a head, and caudal is about that walking and movement of the legs. It's just a term. What is the single most important factor to consider when communicating with children? So we need to communicate in a manner that a child understands. So number one, you approach them and you do that on their level and get them comfortable with you. And then of course, show them the equipment, let them touch it, etc. But get on their level, know what it is. So now you're not this frightening person, because what do nurses do the first several years of life? It's always an injection. It's always, doing something that hurts them. Get on their level. Gain some trust. What 2-year-old pain assessment tool should the nurse use? We have flex scale, faces scale, numeric scale, Oucher scales for a 2-year-old, a toddler. What works? So we're going to use a FLAC tool, right? We're going to make sure that the faces, the legs, activities, crying, consolability, if this is the one up to 3 years old. After that, 3 to 5 is faces, okay? They can recognize faces and give me what they want. But FLAC is before that, infant and then nonverbal children, even if they're 18, FLAC. A child requires ophthalmic ointment to be applied to the eyes. What teaching should the nurse give? We use a lot of ophthalmic ointment for like conjunctivitis, right? And we have to give it. But when you give ointment, in particular, it makes the vision fuzzy and blurry, and that might scare a child. So let them know. And we never go from outer corner to inner corner, and we never go from eye to eye. We don't want to spread what's there. But that ointment is blurry for that vision. Kids get scary. I can't see. According to Erickson, school-age children have a prolonged hospitalization should be offered what to promote industry? What is industry? Well, when we talk about Erickson and we talk about industry, we can either do things well or we want to, but we can't. Industry is when children can do something and can do it and do it well, usually. And when they do it, they feel a sense of feeling good, feeling of accomplishment. So industry is a task they do well, okay? There's other tasks they can't. So Erickson is something you need to look at, especially for your HESI and for NCLEX. There's 4 or 5 questions about it. What is priority treatment for a child with dehydration due to profuse vomiting? So if a child is vomiting, you can't give anything by mouth, because what are they going to do? They're just going to vomit up all over again. So priority treatment, especially when you see signs of dehydration, is IV fluids with vomiting. Vomiting and diarrhea have different treatment. The first expected fine motor developmental milestones for an infant begin with, remember, fine is fingers. Gross is get up and go, go, go. So what is the fine motor? So fine motor is you put something in a hand, like the mother puts the finger in the hand and they just grasp it. It's a reflex. And parents go, oh, look, my baby's giving my finger a hug. And they think it's great. Don't tell them it's a reflex. They feel good, but it's reflex. And then it becomes voluntary. An 8-month-old should be expected to perform which fine motor skills? Remember, F, fingers. Gross. G, get up and go, go, go. Like Paw Patrol, right? So an 8-month-old, and it's about 7 months it starts, they should be able to grasp a rattle by themselves. And they should be able to like take little puffs of those little snacks or Cheerios and be able to sort of smush them in their mouth. It gets more refined by just the finger and the thumb as they get older. But by 8 months, grasp a rattle and then a crude sort of smashing it into the face, pincer skills. In general, an infant should triple their birth weight at what months of age? And then I ask you, if they have too much or too little, what do you do? Because these are questions that you need to think about. So they triple at 12 months. Born at 7 pounds, by 1 year, they should be about 21 pounds. And they double it at 6 months. These are things, milestones. If they're too much, we do intervention, and too little intervention. Very important, because remember, nutrition, nutrition, nutrition. RN is assessing a 2.5-year-old toddler should report which finding to the provider? So the head circumference should be less than their chest. Remember, at birth, they have big heads, right? And their chest is smaller. By 1.5 years old, it should be equal or the head should be less. If not, what's going on? Hydrocephalus, brain tumor, what's happening? A mother of a 3-month-old infant is concerned because the infant's head is flat on the back. How do you respond to that? I mean, today we're all about back to sleep because of SIDS, right? So we do have tummy time. So put them on their belly only when they're wide awake. We don't let them be on their belly anymore for sleep or, prone, because they could vomit. They don't have the ability to lift their head. They could suffocate in it. So we really are found through research that putting them back to sleep has decreased the amount of SIDS death in infants, which is what we want. A 2-month-old infant has cradle cap. What should the nurse tell the parents do to treat it? All that white stuff, and it's almost like dandruff, really bad, right? So what we're going to do is we're going to wash it with soap, maybe some nice mineral oil or something, but brush it easily, very gently with a fine comb. And it's not going to come out in one day. So we can do this daily until we get it, all of that stuff out of their hair, that cradle cap. What information about introducing solid foods to their 6-month-old infant will you offer a parent? So 6 months, and now we can offer solid food, right? So how do we do it? We know that infants can develop allergies, and we need to make sure that as we're introducing foods that the infant's not allergic to it. So we introduce one at a time, 4 to 7 days in between the offering of another one. And an allergy could be just a rash. It could be as simple as that. But that rash could turn into a lot more. So we have to wait in between introducing the next one. According to Kohlberg's 3 conventional level of moral development, a preschooler who has moral reasoning does what? Kohlberg, what does he talk about? So Kohlberg is all about good and bad, and there's a consequence for each. So now they're starting to understand, if I do good, I'm going to get praise. If I do bad, it's going to be something happening like timeout or some privilege taken away. Preschoolers do understand this. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? Preschoolers are pretty smart, ages 3 to 5, and maybe they have to do a procedure where a catheter, IV, something has to be done. If we show them a doll and show them what's going to happen, they know what's going to happen, and they're going to be less stressed, and they'll be more apt to cooperate with the procedure. So using a doll does help. Child Life works a lot with that, and it does work. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Well, number one, we know we get on their developmental level. That's always number one. But we need to do more to that child. We need to take blood pressures and temperatures, and we need to listen to them and touch them. So we're going to use play. Let them take a blood pressure on you. Let them listen to their own heart, and they really enjoy it. And you could take 2 minutes to do an assessment, or you can't get one done. Letting them touch it, you're going to get your assessment done. In terms of language and cognitive development, a 4-year-old should be expected to do what? This is a preschooler again. So a preschooler should be able to follow simple commands, like put your dirty laundry in the hamper, or it's time to take a bath, get your clothes off, turn the bath on. They should be able to do these things by then. In fact, you need to encourage them to do it. They want that sense of autonomy. Parents are concerned her 8-month-old child's not developing like their older child. What is normal for 8 months? And these are all gross motor skills because it has to do with movement. They should be able to sit alone unsupported, okay? Pulling themselves to a sitting position, that's not the absolute gross motor. It's sitting alone, unsupported is what they should do. And if it presents with signs of dehydration hunger, and an olive-sized mass in the right upper quadrant. What would you monitor for? What do you think is going on? I also call it a marble. It's like a little, and you do feel it too. It's like right above, right below the xiphoid process, a little bit to the right. You can feel it. And the next thing I'm going to ask for is your child vomiting? And what does a vomit look for? Is it a dribble or is it projectile? What do you think that is? Pyloric stenosis. And then what would you do for pyloric stenosis? Tell the parents not to feed that child. You're going to start an IV and get them prepared for their ultrasound after it's diagnosed and get them to the OR to be repaired. A multi-select. What would alert the nurse to hold digoxin on an infant she's caring for? Now, it doesn't matter digoxin on an infant or an adult. These are the same things we look for all ages. The only difference with infants and adults is your vital signs for all age children. That's why we gave you a handout on vital signs. Heart rate of 90 on an infant's way too low. Should be 140 to 160. Digoxin level, it's the same as an adult or an infant. That kid is digtoxic. And is the kid vomiting? That could be a sign of digtoxicity, just like it is for an adult. When taking an adolescent health history, which is most important, now, adolescents usually, I know I'm one of them, I would say nothing in front of my parents. And especially if you want to ask them very personal questions, have the parents leave the room, and you could do that. Now, do you have to tell the parents what they said? No, unless it's something that could hurt themselves or others, okay? They'll tell you a lot of things without parents. And remember to listen. And they are going to shock you. So try not to be shocked. A multi-select. A 13-year-old status post-umbilical hernia repair complaining of abdominal swelling, pain, and vomiting. What could have caused this? So this is a typical scenario of paralytic ileus. And why did paralytic ileus occur? It's usually because if you're talking about, a hernia is the intestines, and they had to manipulate it and stuff it back in and put a mesh there in order to keep it in. And that manipulation can also cause the paralytic ileus. A 4-year-old is reluctant to take medicines. What intervention should the nurse take? I think probably this preschooler age are the ones that close their lips. They don't want it. They're the hardest to give it to. You send a parent home with medicines to take for 10 days and they're like, oh my goodness, how am I going to do this? But use a straightforward approach, as in, do you want it a liquid or you want to chew a pill? Do you want it in a syringe, a cup, or on a spoon? Give them that straightforward, give them a choice, and then that's what they need to do. And actually they do better like that instead of holding them down and forcing it on them. Usually. What concepts reinforces the developmental of a sense of trust for an infant? Well, we're talking Erikson here. Erikson's infant's all about a sense of trust. How do you do that? What does that mean? Well, the sense of trust comes from the baby cries, somebody goes in and picks them up. Their diapers changed, or they're held, they're burped, or they're fed. So that knows that I cried, somebody's going to take care of me. So they can predict what is coming and their needs are met when somebody comes gets them. An infant's NPO and unable to take breast or bottle for feedings. What is important to remember? So if an infant can't eat for whatever reason, like esophageal atresia, tracheoesophageal fistula, you can't because they're going to aspirate. I mean, not even little bits of anything. You need to remember, how does an infant soothe themselves? They still need to remember how to suck because it soothes them and it also gives them comfort. So offer that non-nutritive sucking. No sugar water, nothing on it, because they will choke on it in some cases. When teaching sex education and contraceptive for adolescents, what should the nurse consider? Many times you're talking to an adolescent, with the parents out of the room, and, some of the problems is because they are having sex. So they're going to ask you questions about what do they need to do. So the way to do it properly is tell them, now, not your opinion, but tell them about education, about different things they can do, and also give it to them in some sort of written form. They can go back and they can refer to it. So now they have all the tools they need to make the best decision they can. The monthly immunization for RSV is what? And remember, RSV, we give this immunization from early winter or late fall into early spring. It is once a month. It is given to those immunosuppressed premature children that if they got this RSV, which is a common cold for you and me, but it's a lot of mucus and they can't suck, swallow, and breathe. And giving that mucus in their nose and little fever puts them that they have to work too hard and can be very dangerous. It is called Synagis or bevacizumab. Indomethacin is used to close the PDA. Humira is used for your idiopathic arthritis, and Hib is your hepatitis, which we do give at birth. An infant with hypoplastic heart syndrome is becoming tachypnic, taking a long time to eat, and requires rest. What assessment's priority? What is going on? What do you think this is? You're talking about a cyanotic heart disease, congenital, hypoplastic left heart syndrome. That left heart ain't working. Now, if it's not working, they're becoming tachypnic. It's usually because they're not getting the oxygen they need. So it's about their lungs. So auscultate their lungs. They're probably going into failure. And when they need that rest, long time to eat, it's probably failure. So make sure you listen to the lungs. When doing an admission on an infant with a low-grade fever and loose cough, what information is priority for placement? I mean, admissions called, you get an infant in, has this, and that. What do you need to know in order to put them in the proper place on your floor? It really is a concern that you have to think about. And it's their immunization status. I mean, is this just an upper respiratory, Or is this pertussis? It really is a difference in how you place these children. Understanding fever, medications, that's after admission, and then APGAR scores, that doesn't make a difference for placement of this child. It is their immunization status. When administering antibiotics for a child with pharyngitis, what should you monitor? Antibiotics. And does it matter what they have? They're giving antibiotics to a child. What are you looking for? And you're looking for an allergic reaction. You know, many children have not received many antibiotics during their lifetime, and it might be the first time they got it. So you're going to monitor for an allergic reaction because of the antibiotics. And it could start out as a rash, or it could go anaphylaxis right away. So making sure we look for it, be aware it could happen. When teaching a parent of a child newly diagnosed with acute lymphocytic leukemia, what are early signs and symptoms of an infection? And actually, we need to teach this to our parents, right? Because if this is happening, they need to get treatment right away. And that's a rectal temp of greater than 100.5. There are many immunosuppressive diseases, sickle cell, acute lymphocytic leukemia, cystic fibrosis, any of these immunosuppressed children, they have a temperature, they need to be placed on antibiotics right away. They do not have an immune system that can deal with it. So ALL just happens to be the diagnosis I put here, but any immunosuppressed child with an infection, that fever, it needs treatment now. A 3-year-old's brought to the ER with increased wheezing for the last 2 days, and the child uses an MDI. What information is important to understand? I want to know if they've used a spacer. You're talking a 3-year-old, you know, is using an MDI. Are they getting the medicine? It's getting worse, but are they getting the medicine? So the spacer question, #1 priority to ask. I'll multi-select. What is included in the plan of care for a child with cystic fibrosis? We know cystic fibrosis is 2 components that we have to watch out for. We have to worry about their lungs filling up with mucus and their small intestines not being able to absorb nutrients. So high protein diet for these children so that they get enough nutrients. Of course, aggressive chest physical therapy, whether it is vibrating chest or hands doing chest PT. And then of course, pancreatic enzymes with meals. And the one thing I think we forget is increasing doses as they get bigger and older, making sure that's done because they need their nutrients. How do we know if they're getting nutrition? Height and weight always will show you that. Which information is most important when rheumatic fever is suspected? So rheumatic fever is because of pharyngitis, a strep that wasn't treated. And of course, we treat rheumatic fever with an antibiotic. Our biggest concern is heart valve. Once it's damaged, you cannot repair it, but everything else we can. I'll multi-select. What are some assessments that an infant would have if they were in acute respiratory distress. You know, in acute respiratory distress, you're going to see tachycardia, tachypnic, nasal flaring, but what's very significant is the grunting. And what would it sound like? It's like after each breath, they and when you hear that, you know this kid is going to collapse pretty soon. This kid, you need to take it seriously because they'll go in respiratory apnea and cardiopulmonary distress if we don't take care of it quick. So nasal flaring is a start with tachycardia, but then the grunting is what's showing you this is extremely serious. What is the purpose of giving indomethacin to a neonate with a patent ductus arteriosus? So a PDA is fetal circulation, right? It connects the lungs to the pulmonary artery, to the aorta, and it allows oxygen to go into the body sometimes. Sometimes it's there and we don't need it. And we can give indomethacin because to keep that duct open, somewhere this body has something called prostaglandins. It keeps it open. So you give indomethacin and it blocks prostaglandins from being manufactured, and it closes the duct. Then I'll ask you a question. As you are giving this indomethacin to the infant, usually it's a 3-time dose. How do you know when it closes? The murmur goes away. You can actually hear the murmur between the pulmonary artery and the aorta. When that closes, it's gone. So you know it's worked. It's like a washing machine murmur is what it sounds like. How do you get an adolescent to open up about their sexual history? No, you've already said, have the parents out of the room. Now you've got this child. How are they going to talk to you and be open about it? Well, again, get on their level, right? Developmental level in adolescence. So what do you want to be when you graduate school? Or I heard you listening to music. What sort of music you like? Give them something about their social, about them, and then they'll start to open. And as they're talking, listen, pay attention. What is the greatest risk factor for a newborn receiving a cardiac catheterization? So if you think about a cardiac catheterization, they go into the femoral artery and vein with a big catheter. So once it comes out, there's a chance of it bleeding out and a huge hemorrhage. I mean, that's why we put a pressure bandage there. And the first thing you do when this child comes back is to look to make sure that dressing is dry and intact. So it's hemorrhage is the big thing. Infection? No. Arrhythmias? No. It is hemorrhage. Which symptoms exhibited by a 3-year-old with croup is priority concern? So croup, what is it? It's inflammation of the oral pharynx. It is a seal barking. No fevers usually. Now, if you have an oral pharynx and you're croup and you're barking cough, and now you can't swallow that swelling has gotten big. That inability to swallow is now telling you you're getting close to epiglottitis. So that is the biggest priority concern. A child goes to the ER with respiratory distress. They're anxious, leaning forward and drooling. What action is priority? What do you think's going on here? You know, when you hear anxious, you think of hypoxemia, okay? Leaning forward, that means you're having difficulty breathing. And drooling, they cannot swallow. This is epiglottitis. That drooling, okay? And the anxious, all right? So when you have epiglottitis, you may lose your airway. So the priority is to have a trach tray and an intubation supplies at the bedside in case we have to breathe for them. A 10-month-old status post VSD, getting morning meds. What meds should a nurse question? Blood pressure 118/70, temp 99, pulse 88, respiratory rate 22, a 10-month-old. They've just had a ventricular septal defect repaired. So that heart rate being down, what med affects the heart rate? Digoxin. What do? You hold it. Call the doctor. What do you think they're going to do? They're going to order a digoxin level. While assessing a newborn infant, you notice decreased femoral pulses bilaterally. What action should you do next? Like, what would cause a newborn to have decreased femoral pulses? Well, when you're talking about femoral pulses, that means blood flow off the aorta going down to the body is decreased. This is coarctation of the aorta. How do you diagnose it? Well, because you have less blood going down to the feet and you have probably more going to the upper extremities, you're going to do a 4-extremity blood pressure. So it's lower on the bottom and higher up top. And then what do you do with that information? You tell the doctor, and they're going to do an echocardiogram. A multi-select. When educating adolescents about risk for HIV and hepatitis, what would you include? What do they need to know? I mean, we're always going to recommend abstinence, but you know, adolescents will do what they want. Condoms, of course, we'll recommend, and then always hand washing for anything. We will include that. I mean, adolescents will do what they want, but at least we're giving them, you know, good information. What discharge teaching would be needed for a toddler diagnosed with hemophilia? Well, number one, what's hemophilia? Hemophilia is that bleeding thing, right? Where they bleed, they're missing a factor. Whether it's factor 8, factor 9, whether it's von Willebrand's. Now, toddlers are running all over the place, so we want to protect them. So this is safety. So you're going to pad any sharp corners of furniture. I mean, the sides of your table, dining room table, or your coffee table. Those are big things that they bounce into. You can't limit a toddler. They're going to do what they want to do. So at least protect them. And our last question for today, a multi-select. A child with hemophilia has falling, the knee is swollen and painful. The treatment would include what? So we know that swelling into the knee and the blood could really cause a lot of damage. So we're gonna rice, we're gonna rest, ice, contain, elevate, and maybe at home, we have the home infusion that we could give for these children. A hot pack is gonna increase the amount of bleeding, and exercising also can do that. So that is our concern. So that's what we did for today. We did the first 50. I will do the rest tonight. Now, I did not stop the recording, so it's going to be the exam and then the recording. I apologize. So just fast forward, okay? But you have everything you do need. And I will be doing the second half tonight about 9:15 if you want to join us. So thank you, everybody. You have a question about your exams, send me a message. All I can tell you, thumbs up, thumbs down, or okay, all right? It's been a pleasure teaching all of you. I'm gonna miss you.
Thank you.
Good luck on your HESI, guys.
Thank you so much.
I'm gonna miss you too. Thank you so
you.
much for everything. You're great.
My pleasure.